conversations. Today, which is, I believe, the 20th of June, there's an HIV conference slash hepatitis C conference going on here in Missoula. I was attending, and I booked time ahead so I could grab maybe people from out of town or whatever. And I wound up with 3 people on hepatitis. Everything I know about hepatitis I learned about an hour ago from a session with one of our guests, so it should be kind of fun. I won't have to pretend ignorance or naivete. So let's see if I can remember these people moving down at that end. Buffington is the last name, and the first name is Joanna. Mm-hmm. Elton is the first name, and I don't remember. Mosher. And, oh, God. All right, I'm true of
Marcy Eckerson.
Marcy Eckerson. Marcy is from the state of Montana. She's a specialist, right, or in charge of for hepatitis B. Elton is hepatitis C.
Correct.
And Joanna is from the CDC. And you'll do hepatitis of any kind, or do you have a specialty?
A, B, C, D, E, F, G. We'll stop at G.
Joanna, let's start with you. Hepatitis. A, B, C, D. How many letters are there, and what is hepatitis? Is it all one disease? Are they related?
Hepatitis is a fairly general term that just means inflamed liver. And a lot of different things can inflame your liver. Viruses are a group of infections. There are a number of viruses that can inflame the liver. And so that's my area of expertise, is viral hepatitis. But alcohol, some drugs, a number of other things can mess with the liver. Sure. So the hepatitis, the viruses that like the liver are that alphabet soup, the A, B, C. A, B, C, I think we should actually stop there, because those are the ones we really need to worry about in this.
But there are ones that go on.
Yeah, D and E, it really kind of stops there for now.
I had no idea that they were a D and E, yeah. So maybe we should mention that.
And they are all different. The only thing they have in common is that they like the liver.
So they're not.
Each of these viruses is very different. Like, the flu virus, is different from,
okay.
The pneumonia viruses, and the hepatitis viruses are all very different too, but they like the liver, so that's what they have in common.
Okay, we got B and C here, so why don't you tell us about A? Let's dispense with A.
Well, A is the virus that is passed from person to person through feces that get in your mouth. I mean, that's putting it pretty bluntly. And some people sometimes get shocked by that. Well, how could that happen? Well, fecal material can get into things in very minute amounts, so it's really not that difficult. Contaminated water or food, someone who's ill and has hepatitis, it's shed in their stool. So if people aren't really good about washing hands after going to the bathroom, and then have close contact with other people, including making food that isn't cooked that other people eat, or having intimate relations with someone, if you're passing anything where there might be fecal material in it with the virus in it that gets into someone's mouth, use your imagination, you can get hepatitis A infection. It can make you sick as a dog. Children that get it usually don't get sick. In fact, they usually don't have symptoms at all, and that's one of the kind of hard things to track, because kids are, as you probably know, the smaller they are, the less likely they are to be good about washing their hands.
Is it fatal?
Rarely. Usually, if people have symptoms at all, and the older you are, the more likely to have symptoms, fatigue, nausea, vomiting, jaundice, light-colored stools, dark-colored urine are the symptoms, and you can feel really lousy for sometimes weeks, even months, but most people will get over it. However, if you have liver problems already from anything else, you're much more likely to have serious problems and can die from hepatitis A. About a 0.5 to 1% of people that get infected will die from liver failure very soon after infection, but most people get over it, and then you're immune for life. months.
Oh, that's...
If you've had hepatitis A once, and recovered, you're fine.
Okay, that's A. Moving right along to B, would you care to explain B? Different
Hepatitis.
disease entirely, right?
Different
Okay.
disease entirely. The commonality is that it likes the liver too. Just like strep likes the throat, hepatitis viruses like the liver. Hepatitis B is a real diverse virus. It is about 100 times more contagious than HIV is. It can live on a surface for 7 days, and CDC estimates maybe longer in dried blood. So it is very communicable if there is a port of entry. Hepatitis B is either bloodborne, blood-to-blood transmission, or it can be an STD. So we have a couple areas of concern with hepatitis B.
It's like HIV, same.
Same
You can get it
transmission
through sex or
through that.
transfusion, I suppose,
You bet.
before they cleaned up the blood supply, et cetera.
Before that, and IV drug users, when we share those needles and go blood to blood, that's a real problem. High transmission. If a virus is there, there's a real likelihood that it will transmit.
And 100
because it is
times
so
more,
viral.
it's really contagious.
It's very
as opposed
contagious.
to HIV, which is a little harder to catch.
Right. And as opposed to Hep C, it's 10 times more communicable than Hep C is. So it's a real problem. The good news about hepatitis B is that it is preventable, that we have a very safe vaccine that we can prevent this disease with if we can immunize before people have those risk factors.
I'm going to come back to that with the prevention things.
You bet.
And could we go on to hepatitis C, which is supposedly one of the topics of this conference?
Yeah, hepatitis C, yet another one of the viruses that impact on the liver, is, as Marcy was saying, is 10 times more infectious than HIV, but it's more prevalent in the United States than HIV and hepatitis B. CDC did some studies a while back, and they estimated that 1.8 of the U.S. population has been infected with the hepatitis C virus. What that amounts to is about 3.9 million people out there have been infected. Now, when I say have, that means a certain number of them have resolved the infection on their own, but that still leaves roughly about 2.93 million people that are currently infected with this virus. And that's one of the missions that we have in Montana, is just to try to educate the population about the risk of hepatitis C and identify those that have been infected.
I kind of skipped over Marcy, and I'll come back to you, but the thing I didn't ask of was fatality. Is it deadly?
It can be deadly. About 8,000 to 10,000 people die from hepatitis each year. Hepatitis C is about 40 to 60% of those individuals receiving a liver transplant is because of the complications from hepatitis C.
Symptoms of hepatitis C?
Symptoms, if you have symptoms, most of those people that do acquire this virus do not have symptoms. And if they do, it may be, a flu-like symptoms for a day or two. If they have the most severe symptoms, it'd be similar to hepatitis A. Get the jaundice, the malaise, the light-colored stools, the dark-colored urine, etc.
Marcy, let's go back to you again. Symptoms and fatality, and I gather, listening to you today, that B is really the nastiest. Is that correct? I mean, although it's curable or preventable, if it's not prevented, it
can definitely impact life expectancy. Hepatitis B, the symptoms for all hepatitises are fairly similar if a person is symptomatic. You're going to see the possibility of flu-like symptoms, jaundice, the change in stool and urine, just a flu-like feeling. Some can be very acutely ill, and with hepatitis B, other factors that are impacting the liver at the time can make a big difference in the outcome of hepatitis B. Hepatitis B can be either an acute case like you see with Hep A, and it can move through that illness process, and the person can build immunity, and then they're immune for life also. It can stay, and the virus can maintain in a body, and that is what we call a chronic infection, and it's really age dependent. with hepatitis B, the younger you are when you are infected, the more likely you are to carry that virus throughout your life.
And be immune to it, or?
No,
No.
To have the virus and always be infected with it. The younger you are, the more likely you are not to be able to beat that particular virus. The older you are, the more likely you are to have an acute case that could be symptomatic, to have your body beat that and build immunity. So it's really an age-dependent thing, and with hepatitis B, we really are concerned about the potential for pregnant women to pass it to their infants unknowingly without us doing intervention and giving that baby some prophylaxis immediately and following up. That baby has a 90% chance of becoming a chronic carrier. Our chronic carriers, over a lifespan, 15 to 25% of them will die prematurely in their 20s, 30s, and 40s from liver failure, liver cancers, because that virus is continually impacting the wellness of that liver. If you add other infections, like you are co-infected with HIV, co-infected with Hep C, or have a case of Hep A on top of hepatitis B, then the impact is more deadly.
So if a mature person gets A, B, or C, and has no other factors on top of that, they're liable to go through it, develop an immunity, and...
Hepatitis A is an acute illness only. People go through and they build immunity.
Okay.
Hepatitis B, 90% of our our old adolescents and adults will go through the illness and they will build immunity, and then they'll be immune for life. Hep C is a little different. Elton, do you want to?
Yeah, Hep C, first of all, there is no vaccine for hepatitis C. And there is no sure cure for hepatitis C. There are some medications out there that can put you into what they call a sustained responder. This means you don't have any virus presence for a period of time. However, if you engage in the risk factors that caused you to acquire the disease to begin with, you can go reacquire the disease again. So there is no immunity.
Okay, kind of to repeat, and for you, and I want to throw HIV in here. There's a period of, because HIV is a disease I know most about, it's possible to have a period where you sort of have flu symptoms, you might have any, strange things happen, and then you get, now with HIV, and you can get better, and then you have a long period where you don't know that you're sick unless you test. Now, is that fairly standard with these other three, or?
With hepatitis B, the younger you are when you're infected, the more likely you are to be chronic, the less likely you are to have any symptoms at all. You may not even have any illness symptoms, but that virus is there, it's present.
Yeah.
So there may not be any flu-like or illness symptoms at all with hepatitis B.
You were going to say something.
Yeah, the thing with hepatitis C, most of the people who get infected, whether they're young or old, most stay infected. That's what makes it very different from A, which has no chronic form, and B, where far fewer adults stay chronically infected. But the thing I wanted to emphasize is if you have the chronic infections, B or C are the ones that in some people can go on to have, with continued sort of attack of the virus over the years, especially if you drink alcohol, which can make it much worse, you can go on to liver scarring, which we call cirrhosis, or liver cancer. But again, that's not the majority of people. It's probably 15, 20%. But if you're talking about 3 million people plus another million, a little over a million, so 4.5 million people in this country with chronic hepatitis B or C,
becomes a substantial problem.
then take 20% of that number, cirrhosis, and even once you develop cirrhosis, many people can be stable and die from something else, and most people with chronic infections are going to die from something else, but about 5%. So working our way down there, about 5% with that cirrhosis or liver cancer. If they don't get a liver transplant, they will die from liver failure in 20 or 30 years from when they first got infected. So that's a lot of people if you're starting with 4.5 million.
And you figure that most people that have hepatitis C right now acquired the disease back in the 70s and 80s. So that 20-year period, we're right in it right now.
Yep.
That's why we're starting to see a lot of those cases that are becoming more evident.
Right. And
developing
they didn't have any
problems.
symptoms. I mean, they might have had symptoms, 20% might have had symptoms early on, but never thought twice about it because they got over it. And then now 20, 30 years later, when you get symptoms from liver scarring and liver cancer, that's very advanced. The symptoms, I mean, that's pretty serious. But if your liver's failing, you're going to have symptoms then. But
There are
that's
tests
late.
for all three of these?
Yes.
Yeah.
You can. Are you likely? I'm HIV positive. I see my doctor fairly regularly. Is he likely to have tested me for any of these?
We would hope so. Since you are HIV positive, you are also at risk for hepatitis. And so I would think that he would test you.
Should I ask him just to make sure? Because he's never brought up
I certainly would.
any
Remember
possibility.
that the transmission is real similar with especially B and C. And Hep A, there's that potential during that acute period to transmit that way also.
And with B, it's the same way. You get it the same way as HIV, so people might have both. You might get them at both at the same time. Is that correct?
Exactly. When, if the virus is present and there's a way to transmit that from person to person, there's that potential. So, the way HIV is transmitted, Hep B could have been, if it was present, it could have been transmitted also. Hep C.
Joan, you.
Or Alton, you were gonna.
Go ahead.
The one place where it really is different. I mean, if hepatitis C really is bloodborne. I mean, it's much more likely to be passed if you're sharing any equipment that has blood on it, like needles, syringes, cottons, cookers for drugs. It's far less efficient transmitted through sex. Very different from B, which is very easily transmitted through sex. So if you acquired HIV and or hepatitis B from sex, but you never injected drugs or shared blood, then you're not at increased risk for hepatitis C. But again, if you're HIV positive, if you're on medications that are affecting the liver, and for all sorts of reasons, just for your general health, it probably is a good idea to test for that reason, not so much because you probably, if you didn't share blood or inject or do that, your risk is lower. But just for following your general health, it's probably a good idea.
For someone like Joyce Watson, who watches this show, the only person I know regularly who's led a heterosexual, I'd hate to categorize now that I've mentioned Joyce, but let's say a regular, fairly normal, non-shooting, promiscuous sort of existence. What are their chances?
Well,
Should they be worried? I mean,
with hepatitis B, because it is both bloodborne and STD, originally they really looked at high-risk groups, and they found that they did miss some, that some really had an unidentifiable risk. But if you are a person who has not had a blood transfusion, you're in a monogamous relationship, you aren't a person who is a hemophiliac or an IV drug user, you're not, having blood and body fluids regularly exchanged, you're in a very low-risk category.
for B and C. A, you can get from the tuna salad at the church social, right?
Yeah.
Somebody could have.
Never know.
Yeah.
Yeah. The other, I'm not sure where Montana sits. I know there's a lot of hepatitis A traditionally on the west coast and the border with Mexico. A lot more hepatitis A in the southwest. Montana, I think, is
We are an intermediate.
intermediate. So.
And we've had a few clusters, which is what puts us at an intermediate risk for Hep A. We have a little higher incidence in a couple mid-size towns, and we've had a slightly increased risk around some of our reservations.
Yeah.
So that puts us kind of in a moderate risk.
Yeah, there is, the reason we sort of discuss is there is also a vaccine for hepatitis A. It's a pretty new vaccine, 1995. So it is important for people to know that that exists. It's one of the few vaccines that's just about 100% effective in preventing the disease. And so it is recommended for people who have other liver conditions for whom if they get hepatitis A, it's going to be much worse. People with chronic liver disease or other chronic illnesses, diabetes, chronic lung disease, people that already have enough going on. That's a group that probably should get vaccinated.
It sounds like it's something that I might check now. Is there an antibody test or something?
Well, yeah.
That I have my doctor check
Yeah,
to see if
yeah.
I'm all
And
ready?
if you've got the antibody, you're all set. And it's estimated about a third of adults 40 and up in the United States have already been exposed and are immune. So, the older you are, you might say, well, maybe I'll just check to see if I've already had it. Although the vaccine won't hurt if you have.
But there is a panel, a hepatitis panel, and that can include A, B, and C.
Testing
So,
for all.
if you're going to get a blood draw, it's nice if you could do all of them and then know what you are and follow with vaccine if you are not immune.
I listened to this lady talk today, so I probably ask you more questions because I know what you know, or at least some of what you know. Talk to us. B has real problems for children.
It does.
And you may think of these as for some of these things for gay people or for wild liver people who live wildly, but let's talk about children and hepatitis B.
Hepatitis B, as I said, is really age dependent on whether you're going to be infected and chronically stay infected or whether you're going to be acutely infected. And what we find is that the younger you are when you're infected, the more likely you are to stay infected. And that makes you contagious. The potential for transmission to others is there. And it also continually is a virus that's impacting that liver. And one of the biggest transmission concerns we have is when a positive mom who has the virus for hepatitis B gives birth to a baby, because that birthing process that baby has such close contact with all mom's blood and body fluids during that birthing process that's a real heavy-duty exposure. So we have the opportunity to do prevention there. The incubation period for hepatitis B is anywhere from 45 days out to 180. So if we can do something to help that baby prevent infection immediately, we can be that safety net. And we do recommend hepatitis B vaccine for our newborns as that safety net.
For all newborns?
For all newborns.
Is that happening in Montana?
We have about 90% of our infants now in Montana who are being offered the birth dose, which is very exciting that we can do that. In the last 3 years, we have really worked hard to bring those numbers up, and we've had 4 infants that we have found through different ways that we have missed identifying the mom as a positive. So it really puts that baby at increased risk.
So if you might miss identifying the mother, it's a good idea that all...
That becomes such a wonderful safety net because it is a very effective vaccine.
It's something that parents should think about with their kids.
Definitely.
What about, she said 90% in Montana. How's the rest of the country doing?
Actually, it's pretty well. Since the recommendation for what we call universal, meaning everybody, all infants should get vaccinated, that was made in 1991. And in the first few years, early 90s, it jumped right up. I mean, getting kids vaccinated is something, it's not Democratic, it's not Republican, it's bipartisan. Everybody wants to protect kids, so it's worked pretty well. The other big thing is there's been funding for vaccines for children. So it's covered whether you have insurance or not. Most states, can get vaccine into children. It's when we get up. So it's actually recommended that everyone up through age 18 be vaccinated for hepatitis B. When you get above 18, if you hadn't been vaccinated through whatever programs, and remember this, was only since the early 90s it was recommended for infants, then we try to get adults with risks, and it's much harder to get those people in. They're usually then at a point in life where they're not going to regular medical care, and it costs money to get vaccine that might not be there.
Is it a one shot, you just take a shot and it's over, or
That's 3.
3 shots?
Yeah.
Okay.
The other thing about our young adults, our adolescents and our young adults, is that's where we see 70% of our acute cases. They're in lifestyle situations where they're at higher risk, whether it's through their work, they're working as a lab tech or a doc or whatever, or they're engaging in unsafe practices, IV drug use, sexual partners without prevention, those sorts of things. And we see 70% of all of our hepatitis B acute cases happen in that age group. The impact is there, if we can do the prevention for them before they become infected at that, I call it the childbearing age. We see that in those adolescents and young adults. We can also do prevention in our infants. I mean, it's a whole life span of prevention.
Now, if you're doing this with 90% of the infants, and you're doing this assuming, you know, it goes on, will the need to do older people disappear?
That's the hope. Because we have so many chronically infected individuals, and they can continuously be infectious, it's going to take a while before we have everybody else immune so that it can't be transmitted.
She's chomping at the bit.
Yeah, I was thinking it'll be another 20 or 30 years, and when you've got a great vaccine, I mean, we can't really stop trying to still vaccinate people above that age who are still at risk and not already infected. And so getting vaccine into adults in STD clinics is key, in correctional facilities is key, people with multiple sex partners. I mean, these are groups that are, you know, it would be
At
great
risk.
if we could
And we don't have an adult vaccine program right now. It would be ideal if we had funding to be able to provide the vaccine for this age group. And that's why we work so hard at trying to vaccinate, catch up the kids that are 11 to 12 who are coming in for their middle school shots, and really reach all of those adolescents as they come in for sports physicals or they come in for family planning or STD concerns. But we really do have a population of young adults that we don't have vaccine for. And that's really sad when you know you can do something to provide that prevention and safety net and you don't have the means to do it.
And no vaccine for C. If
No
I'm
vaccine.
repeating myself, it's for people out there. No vaccine for C.
Nothing
No
down
cure?
there either.
But who should get tested for hepatitis C? I think.
Excuse me. Those that should be tested are
Yeah.
anybody that may have had a blood transfusion or blood product prior to 1992, anybody who currently uses or has used IV drugs, anybody that's been under hemodialysis for a number of years, or anyone that has had multiple sexual partners and a history of STDs.
Yeah. Actually, the multiple sex partners we're still kind of, CDC is still kind of not sure about because more and more studies are looking at, it usually comes down to,
Other factors that are
other
in there
factors
that
that
they're not
are
admitting to.
direct, blood, most likely. Again, sex, it can be transmitted through sex, but it's very inefficient. If you look at, this is the way one of our docs describes it, of 3 million people with infection in the U.S., there may be maybe 20% of them got it through sex. That's, what's 20% of 3 million? I don't know, 500,000. Can't do quick math, but say 500,000. So that's a lot of people, but how many people have sex? A lot. I mean,
Daily basis.
100 million, 200 million. And so if you look at the percentage that got it from sex over everyone that's having sex, it's actually a very small risk. If you look at people who got it from injection drug use, sharing anything, and we're talking also about somebody who might have, at Woodstock, how many years ago was that? 25, 30?
Yeah.
In the 60s, might have experimented and wouldn't even think today, I'm not an injection drug user, would forget or just, not realize that something they did 20 or 30 years ago, but I feel fine today, they could have cirrhosis developing and not know that. So that's far more of a risk. And that's why we're really pushing that anyone who ever injected should get a test. And we're really concentrating more on that than the sex part, because it just shows more and more that sex is not an easy way to get this. So.
And Hep B is different. We don't recommend testing generally for Hep B unless you fall in certain categories. Bloodborne transmission, if you've had an exposure through work where you had a needle poke, or if you are an IV drug user and you've come in for counseling for either HIV or STD counseling, that is an appropriate time to look for both B and C. But generally, we found we had a population, an 18-month spread where we had 21 acute cases of Hep B in one of our regions in Montana, and we had over 200 close contacts, which we tested all of them, and we found less than 10% had Hep B. So it was much more cost-effective and important to get that vaccine in them than to worry about testing them prior to vaccinating. So Hep B is a little bit different angle on the testing.
Okay, so B is 100 times
More infectious.
easier to catch than HIV,
HIV.
and C is 10 times more than HIV. And yet, I know people, if they have unsafe sex, are running to get tested for being HIV positive, even if they don't know the status of their partner, or da-da-da, and they worry, and I say, it's pretty unlikely, but, so what about if you have unsafe sex with someone, and should you be worrying about B, and should you run and get tested or something, and when should you, and how the incubation period and all that?
That's a really good question. I used to work in public health where I did HIV and STD counseling, and many of the clients that we had were the scared low risk or moderate risk group. And I think it's really important to counsel them and help them understand that all it takes is for one of those viruses to be present. That if the unsafe activity is there and there is HIV or hepatitis B or hepatitis C present, the transmission is a potential problem. And I think I use that occasion to really talk to them about the vaccine. This is one we can prevent. When they came
that's
in,
smart. Instead of worrying about when you have unsafe sex, get the vaccine.
Let's do some prevention things.
Okay.
A lot of intervention on safe sex, on if we're IV drug users, bleach kits, if you feel you have to share needles, not sharing needles if that's a possibility, because you have to be able to help them where they are. You have to be able to try to do prevention. You're not going to say, don't ever have sex again, don't ever use IV drugs again. You have to say, this is where you are. A lot of them were folks who were either divorced and newly dating, that really had only thought, I'm not worried about pregnancy, and then all of a sudden they're back in this world where there's risks. And I think talking about prevention and helping them do those interventions before.
We might mention how many sexually transmitted diseases besides AIDS?
There are sexually transmitted diseases, as far as I know, I think there were 26 that were identified. And that
That's
includes...
a thrilling idea.
Yeah. And I like to look at it like a herd of cows. If the barn door is open and there's 12 cows there, they can all come in. If the barn door is open and there's one, they're likely to come where the hay is too. So if you're doing risky behavior, you're not using a condom, you're sharing IV drug needles, whatever's there, you're going to share with that person. If that person is infected with something, that potential is there. So,
just as a footnote, condoms do not prevent all STDs, right? There are some that a condom...
Well, I think the one that I know it's not well protected for is genital warts, because the warts can be sort of invisible and be outside where the condom's covering. That's the one main sexually transmitted disease that I know condoms aren't that useful.
herpes is another that...
Herpes may also be,
Outside of that area.
Yeah.
I want to kind of take a turn on this, and maybe if you guys feel that this part of it you want to go back to, that's fine, but... okay, my connection was HIV, and I'm a civilian, I guess, but at least I'm fairly knowledgeable about that. I have for some time been kind of advocating that instead of trying to prevent HIV, we focus on STDs. That, parents who can't believe their kids might get HIV, I think, well, maybe gonorrhea or something else. And also, these things don't have that kind of gay stigma that AIDS does, and it'd be a lot easier to sell these things as a package of, At the same time, there's also been this kind of push towards people with intravenous drug use, and we got to do something about that. And I'm going, hey, hold it. We haven't found HIV in the intravenous drug user population, so why are we spending this money?
Here in Montana.
Here in Montana.
Here in
I think
Montana.
that's a big
I mean, are we just bowing to the fashion of the rest of the country? And then all of a sudden we have this, as CD, what am I trying to say? Okay, hepatitis C kind of comes on the screen maybe a year and a half, 2 years ago. Jim Murphy, state epidemiologist, says there's been an outbreak of hepatitis C in the eastern part of the state among the Indian population, and in some ways that's good because it's telling us something about HIV, blah, 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 blah. Would you care to, maybe I should finish this. So all of a sudden I'm thinking, well, hold it, if hepatitis is one of these STDs, then maybe I've got it wrong, and that maybe we should, hepatitis is kind of a nice way of reinforcing or addressing all these things together. Am I making some sense?
Yeah, perfectly. And you addressed a problem that CDC has acknowledged, and we have acknowledged here in Montana, is that we got all these fractionated services out there. We got HIV services, we got STD services, and hepatitis services. And they all cover basically the same elements, the same risk factors. So somebody came up with the great brainstorm here. Well, let's combine these services. Let's integrate. And that's what we're trying to do at a national and state level, is integrate all of these services into a one-stop shopping for somebody that might be at risk. They come into a clinic or something, they get assessed right there for what their risk factors are. And once those are determined, then that individual is tested appropriately.
Or vaccinated.
Or vaccinated.
So whose idea? This is the first HIV and hepatitis conference in the state?
For Montana,
For
correct.
Montana. Whose idea was that? Is that just a
It's an idea.
CDC?
Part of our effort to integrate these services, we need to start communicating better together.
Care to
But I
address the
think nationally,
CDC's point?
Yeah.
Nationally, you've been trying for about 5 years to bring in the STD folks with
Yeah.
hepatitis.
Right.
And
I think nobody can take full credit. I think it's, to use one of the barn door's open.
Yeah.
We've heard anecdotes from different parts of the country. So in some places, the people coming into clinics say, hey, this is what I'm worried about, hepatitis C, hepatitis B. It's being driven by the clients, the patients, the population. In other places, that hasn't happened, and it's being driven by the healthcare folks who went to a seminar or something, and in some states, legislation comes up because of a legislator has a friend who has. So it's really started like little wildfires all over the place, but it's coming together in really making sense, and people are starting to realize that working HIV, STD,
But
this
is
makes sense. Put it together.
the hepatitis Hep C kind of a first step towards getting all these other things together, or is there a
I
real
think,
reason why these two?
As an STD nurse, as a person who did HIV and STD counseling, I think those of us that did that, could see a big picture. That we knew that if, like I said, that's my little thing. I think of a herd of cows, and there's 26 sexually transmitted diseases, so that's my little herd. I don't think you can have someone come to you with concerns about HIV testing without saying, look, we need to talk about how we can prevent all this, including pregnancy. And so I really think that, like you said, it would be nice if we could focus in on one that's a little easier to talk about with our population. But I found that Hep B isn't a lot easier to talk about than HIV, because there's still folks that are saying, well, why are we immunizing infants if we're worried about sexual activity? And we have to look at all the possibilities. And I think it's just a hard subject to talk about anything that's can be an STD or a bloodborne pathogen with alternate exposures. And I wish there was a really good answer that we could all jump on the bandwagon and say, you know, we need to do prevention. We love each other. We care about you know, prevention, and we need to be able to talk frankly. Sweden's a good example. They have the lowest, they're the first world country that has the lowest unmarried pregnancy rate, teen pregnancy rate, and the lowest STD rate. And they're a very open population. They talk about prevention. They don't just say, get in the car, here's the ignition, here's the gas pedal, don't worry about the brake, you can figure that out later. And I think that's what we have to get to the point where we can talk frankly with each other about prevention. That there are ultimate choices that some are safer than others, but prevention is the key. That's my philosophy.
Interesting. Reminded me of something. I would like to hear, or I'd like the people out there to hear about this outbreak of hepatitis C in the eastern part of the state. Would you?
What outbreak hepatitis C in the eastern part of the state?
In the Native American population.
That was actually an outbreak of hepatitis B.
B?
That was
in the Region 8, which
Cascade County.
Cascade County and that region. It was 21 acute cases of hepatitis B. It was a very deadly outbreak. Normally, when someone has an acute case of hepatitis B, the death rate is 0.5 to 1% of those folks will get a fulminant deadly case of hepatitis B. In this particular outbreak, we had 10 of our 21 acute cases who died. So that's almost 50% death rate in this population. And CDC did come in and help us to research and try to figure out what had happened here that made this such a deadly outbreak. We had, in that population, we had a cluster of about 200 close contacts who were either IV drug sharers and or sexual partners. And what we found in those folks who had the acute hepatitis B is that most of them also had Hep C.
So that's why I got the idea that it was a Hep C outbreak.
Ones that passed
the
away
ones
were Hep
that
C
died,
positive.
the 10 that died
two of
had
them.
Hep C, and I think almost like 9 of the 11 that survived had Hep C. So there was, the co-infection was a real problem. In addition to that co-infection, they were doing some other things that hurt the liver. They were using several kinds of drugs. There was cocaine, there were methamphetamines. They were augmenting that with alcohol. Some of them had flu-like symptoms. They had the symptomatic case of hepatitis B. So they thought they had a case of flu or whatever, and they took Tylenol, acetaminophen, to try to reduce their flu symptoms. Well, acetaminophen is really harmful. It's real harmful to the liver too. So you impact the liver with all of these drugs. You have Hep C and you have acute Hep B. The other thing that happened to the folks that died were that they didn't eat, they didn't maintain, so they wasted in addition to that. And so they had a lot of things that impacted their case. The 200 contacts were tested, and we found less than 30% were Hep C, and less than 10% had Hep B in those close contacts.
Like from the past infection marker.
Right. So that population, we worked hard to try to vaccinate and to do prevention education on how to prevent.
And other diseases within that population? Because this was a great opportunity to see what was going on.
Right. I think, a lot of work on the bloodborne pathogen problems. If HIV had been introduced to that population, we would have seen an outbreak of HIV too, because the barn door was open. You know what I mean? They were sharing blood and body fluids, so all we would have had to do is have one person who was HIV positive come into that population, and we would have seen the possibility for transmission of that also. We had 10 pregnancies that we followed of women who were involved in that IV population. So we worked very hard on prevention with their families and their newborns. And it was just a really big eye-opener for Montana. I think we
Marcy,
felt we were low
I
incidence.
threatened before the show started, I might have to put my hand over your...
What we're doing, we're taking the lessons learned from Cascade County and the outbreak there, and we're applying those to other counties. Right now, we have a campaign going on in Yellowstone County to identify those individuals that are IV drug users or otherwise have risk factors for acquisition of hepatitis B and C, trying to get them in, get them tested. If they come up positive, or even if they're not positive for hepatitis B or C, we're trying to get them vaccinated. So we've been doing this for a year now. We're going to get funding to do it for another year, and hopefully we're going to expand this throughout the whole state if our funding continues. So that'll be a good thing. You know, we can hopefully prevent a lot of future deaths from hepatitis B.
We were talking about the Native American or Indian population there that this outbreak happened. You know, if you're not into something, it's hard to see, you know. I know lots of gay people, I know lots of HIV positive people because I'm both. I think in my 16 years back to Missoula this time, I've only known 2 people that, hold it, 3, 4 maybe, who shot up drugs. Just not on my radar screen. How prevalent is this on all these populations? Do we have any idea?
How prevalent is...
Drug use?
IV drug use. I mean, are teenagers...
Yeah, I just saw
Ordinary
the movie
folks?
Traffic a couple of weeks ago, and I actually attended the Western Governors Association Drug Policy Summit in Boise. And I'm new to learning about the drug problem, but I think it is quite substantial, and I guess I can't really... I can say what I do know about is hepatitis among that group, and hepatitis C is a huge problem. You asked a little bit earlier, you know, why integrate with HIV or other STD? Why are we bringing these together? And I'll tell you, I've been thinking of other sort of reasons that have pushed this all in the same direction. And on the West Coast, in Portland, Oregon, and Seattle, and apparently in Montana, the folks who are using injection drugs, there's not HIV infection. Seattle and Portland both say under 1% have HIV infection. Their friends are dying from hepatitis C, from liver failure. And so that community has woken up and said, hey, government, hey, medical people, why, you know, when you're telling us all this about HIV, what about hepatitis C? It's very different from the East Coast. And the other group, HIV positives, it's estimated that about 30 to 40% of people with HIV infection in this country also have hepatitis C, and it's primarily the people who got HIV through injection drug use. So again, if you look at Baltimore and New York City, you know, half of the injectors in New York City and in Newark and in Baltimore are 30, 40, 50% have HIV infection. It's very different from injectors out in the communities in the West. And nearly all of them, that's where a lot of these studies, 80, 90% of them also have hepatitis C infection. So it's a tremendous burden of disease, and when you think about how does, you know, health, I shouldn't get into health policy, but who votes in the country? I mean, gay men have had a tremendous force with the AIDS epidemic to make politics, change politics, and get things legislated. They vote. Injection drug users
Rarely vote.
It's a huge battle. It's a very, you know, different issue in trying to get funding.
And if I can talk with
Yes,
you.
I didn't mean to stifle you for the rest of
such a good time.
the show.
I think the other thing that we're trying really hard to work on in Montana, because we are a rural state and we have had low incidence of HIV, low incidence of known Hep C until the last few years, and a very low incidence of Hep B, we're kind of in a denial state. We don't work with it a lot. Oh, we don't have those high-risk populations. In reality, this Hep B outbreak told us we do have this population. And we're global anymore. Someone can get on a plane and be in Montana in a day. And so we can't any longer say we are a separate, isolated, safe haven, and diseases don't happen here. And I think that's been something that has had to, you know, it's unfortunate you have the disease and then you have to face the fact that
it's been a rude awakening for us, is what it's been.
When I was younger, every time that my lover and I, boyfriend, would go to a big city, we'd always come back with something. One time it was crabs. One time it was gonorrhea. This was in the 60s. you know, those things could all be taken care
came
of.
back here to
then.
Montana?
Well, I was from Montana. I lived here.
I'm just
You know, we.
See? See?
Well, your fault. I missed something.
But there's a lot of denial about
And
that.
I worry now about, because college-age kids in
Yeah.
the same position I was, they go to the big city. It's liable to be something a lot more
Yeah.
serious than craft
Well,
or gonorrhea.
I'm sure even the news in Montana that a couple of years ago in Chautauqua County, rural upstate or western New York, rural, 100 young females, HIV, 100, actually, how many HIV infections were there? But one guy from Newark or New York City, a drug dealer, came into this small rural county of New York and infected 20 young girls trading sex for drugs with this one guy, HIV infected, and had, when they showed that, you know, that, what do you call that little chart of who had sex with whom, and this wheel, he'd had sex with 120. This is rural New York. People were absolutely stunned, and the blinders just came off. I mean,
Well, it
this
could
is not a
happen.
big
You're
city.
saying it could happen here.
Everybody thinks these things are just in the city.
It's not.
They're not.
Yeah.
Call
We-
Chautauqua County.
Yeah, we have, one thing we identified with the outbreak in Cascade County, we have people that are as young as 13 that are using IV drugs, and as old as in there, I think 64 was about the oldest one that we identified out of this outbreaks. We have seen generations of family members, 2 generations, 3 generations, that are all IV drug users. So it's very prevalent. We're not isolated, like Marcy said, anymore. You know, the problems of the nation are Montana's problems also.
Okay, now is where we start winding down, and final thoughts. First of all, let's address middle-class, heterosexual people who are raising kids. Is this their problem? Should they be concerned?
I think they should be concerned for their children, for one thing. Denial is a wonderful thing, and we all want the best for our children, but I think we have to realize that young adults, adolescents, and adults try on lifestyles and try on partners, and those things are potentially a reality for most children who grow up. The other thing is they need to look, as Elton said, to their past. Do they or did they have risks that would put them in a position to be concerned and tested or vaccinated? Or do they work in an area where they need those vaccinations? So I think it is Montana's problem.
I don't know if I've ever said this on TV, but I shot up twice in the early 70s or something. There was somebody who had it, sounded like a good idea, pre-AIDS, shared a needle.
You and about 10 million other people.
Yeah, I mean, and it was just those 2 times, but I mean, I'm sure there are lots of heterosexuals who did the
Exactly.
same sort of thing. And they should think about that?
It's not a good people, bad people situation. We all make choices that maybe we look back on that weren't the safest or the best. And when we have sex with a person, we have sex with their partners. Anybody they've had, they bring to our relationship. And the same thing with IV drug users. If they have HIV or they have Hep B, they can give that to us. They can share what they've gotten from other people. So I think it's really important that we don't look good people, bad people.
Right. And you can't tell from looking at someone if they're healthy or not healthy. Most people with hepatitis look perfectly healthy. And I mean, that's a real important thing. And people say, well, I feel fine. Even though I had this risk 20 years ago, I feel fine now, so I don't need to be tested. We need to break that, too.
That may
Most people
change.
will feel fine.
Yeah, 10 years from now,
Until
when that
it's-
liver starts to go
Yeah.
down.
Well, and we should add that having watched the course of this disease, it's like all of a sudden one racial group will start going up and gay people will go down. And so there's no predicting where 2 years from now what particular group this is going to spread to. As the out-of-towner from the big world out there, any advice for small-town Montana?
I'm from a small town.
You are? Okay.
Not
I didn't mean to
Montana, but
characterize you as...
I think this meeting is a great thing. That I think Montana actually, it's been quite impressive what the public health folks have been doing. not waiting for federal money, because there still isn't very much for hepatitis, but doing a tremendous amount with limited resources and by people that really care about this. I think that's great, and Montana is ahead of the 8 ball in that respect. If you get dedicated people working on things to prevent, disease and improve people's lives, that's really working for the
Calvin,
best.
last thoughts on C?
We've identified risk factors for hepatitis C. If you can claim one of the risk factors, please go down to your physician or your county health department and be tested. Very simple, very easy to do.
I don't think I've got any last thoughts.
Can I have a last
Yes,
thought?
you can have a last thought. I love you.
I just want to say, as a public health nurse, that we can do so much to augment health. If people have these diseases, we can help them do prevention of progression to a chronic and to a deadly state. And so even if they feel healthy today, if we can identify a problem today, we can do so much with lifestyle changes and preventive motives. And we can also help them prevent transmission to those they love. And I think everybody wants to be able to do that. So I think public health has really got a job ahead of us to be able to
Well,
provide that.
now you gave me a final thought, and that is when I got HIV, well, I got it before there was a test, before there was a name, probably. Why be tested? There was no medication. Now, if you're not aware out there, there are all kinds of things that can be done. It's not a disease that you'd wish on everybody, but it's not one that's necessarily going to kill you. It's like you say, that things can be done. So examine your past, think about it, something you might have done that was risky, and if you have, it's not something to be afraid. Get tested for all these things, because none of them are fun.
That's right.
Okay. Last, absolute last.
I'm hungry.
Okay. It's great to have all of you. Usually I shake hands or hug or something, but
We could do both.
yes.
Thanks.
Okay.
Thank you
Great.
so much for having us.